Hello, everyone, and okay, I'm going to redo that. Hello, everyone, and thank you for joining us this evening for the eighth week of the Rise Institute and Rugby Research and Injury Prevention Group 2026 Journal Club. We will begin our first Journal Club presentation. Our first intern is Jack from Queens, New York. Jack will be presenting on movement demands and I'm sorry, wait, is it professionalism next or journal? Hold on.
You can do journal club.
Traditionally, it's journal
I
club, but
apologize
if
for
we want to
that.
start with professionalism, we can too. I mean, we're supposed to do them all today, so.
Okay, sounds good. I'm going to restart. I won't mess up this time. Okay. Hello, everyone, and thank you for joining us this evening for the eighth week of the Rise Institute and Rugby Research and Injury Prevention Group 2026 Journal Club. We will begin our first Journal Club presentation. Our first intern is Jack from Queens, New York. Jack will be presenting on movement demands and injury characteristics in under 20 years university rugby union players. May you please share your screen?
Hi, everyone. My name is Jack Kania. I'm a rising freshman at the University of Connecticut, majoring in exercise science. And can everyone see my screen? Okay. All right. All right. So today I will be presenting on the article Movement Demands and Injury Characteristics in Under 20 Years University Rugby Union Players, written by Shane Ball and his colleagues. And it was published to the Journal of Athletic Training in 2020. So just first, some background definitions. As many of us might know who have attended some rugby tournaments this summer, rugby is a fast-paced contact sport, and there can be high injury rates within rugby games and rugby matches. And so within this study, researchers used the Global Positioning System, or GPS technology, which I will discuss further, um, to to uh, collect their data. And this GPS technology has been increasingly used by coaches within rugby and within sports in general. But before the study in 2020, little research had been done to analyze the relationship between injury characteristics and GPS derived movement demands within rugby union athletes specifically. So, just some definitions to know for this presentation. Training, there's two different types of training load. First, we have external training load, which is the external work performed or the kinematic output measured. So, examples of external training load can be distance covered or speed. And then there's also internal training load, which are internal or metabolic responses to internal work, such as heart rate or rate of perceived exertion, things that are inside of you. So here's a quick video on the GPS and what it does. So you can see the GPS is almost like a vest, and sometimes a waistband that measures many different has many measure different factors within a person's body. However, in this experiment, the researchers only GPS system only tracked external load and external factors, so it did not track factors like heart rate and things like that. But GPS in general uses satellite tracking and motion sensors to measure activity, physical fitness, and workload in order to collect data on preventing injuries. Um, in this specific study, the GPS measured many different factors such as total distance, high speed running, sprint distance, accelerations, decelerations, impacts, and collisions. Like I said before, all external factors. And so the objective of this study, the researchers wanted to determine the relationship between match injuries and movement demands, also to determine the relationship between match injuries and anthropometrics, which are basically your body composition and your strength. The researchers also wanted to determine the relationship between match injuries and physical performance and the relationship between rugby positions, so forwards or backs. They didn't split it up into all 15 positions in standard rugby, but they split it in between forwards and backs and the workload during the game. So the methods of the study, there were 34 university club rugby players, all from the same university club team, or all from the same university. I apologize. Excuse me. All from the club level. The age range was pretty small as they were university players. 19, the average 19.3 years, and varied by 0.6 years, plus or minus. And this data was all collected during a 22-week competitive season, so it was only collected during one season. The measurements, that obviously they use the GPS system to track these factors, but they use principal component analysis or PC analysis to simplify these many GPS measures into a few measures. And they measure the outcomes of the injuries by classification. So they split it up. They classify these by three categories: either non-time loss or NTL injuries, medical attention time loss or TL injuries, and total medical attention or MA injuries sustained throughout this 22-week competitive season. So as you can see, there are a lot of different measurements that were taken using the GPS system. So the PC system, the principal component analysis system that I discussed before, helped to condense that data and make it a lot easier to analyze and to compare among players. So just the results of the positions. Backs, for those of you who don't know, in general 15s rugby, forwards are referred to as the first eight players on the field that are closest to the opposing team, and backs are the back seven players. And within this study, backs experience greater weekly movement demands. So this, entailed that they had lower anthropometric measures. So they had smaller body dimensions and lower performance capability measures. So, they weren't, as you can see in the data down here, that the backs were consistently able to lift less weight than the forwards, and were also had a smaller body mass and body weight than the forwards did. For the PC, or the principal component analysis results, there are three movement components that were taken into account during the study. First is overall performance, which is pretty straightforward. It's just that a decreased amount of injuries increases performance. They also really put a lot of study into high intensity running, or HIR, performance. And they found that increased HIR, or increased amount of high intensity running that an athlete performed during the season, led to decreased upper limb, trunk, and overall musculoskeletal non-time loss injuries. Additionally, increased high intensity running performance was also associated with overall decreased musculoskeletal time loss injuries, and increased high intensity running also was associated with a decrease of medical attention total injuries. So overall, a athlete incorporating high intensity running into their regular regimen and training overall had an association with decreased injuries overall, whether it was short acute injuries or larger time loss injuries, or injuries that required longer medical attention. And then for impacts, an increase in impacts is pretty something that may sound pretty obvious, but an increase in impacts were associated with an increase in time loss and medical attention injuries, specifically with the head or the neck areas. Just some injury characteristics. So for forwards, upper limb and trunk injuries were the most common, and for backs, lower limb injuries were the most common. And this could be due to the different roles that forwards and backs play within rugby. Forwards, tend to tackle a lot, and so that could be the reason why a lot of their upper extremities and their trunk, which is their torsos, experience more injuries. And then for the backs, they tend to be the ones who are attempting to score tries the most often. So them getting tackled definitely leads to more lower limb injuries and leg injuries than the forwards experience. The average time loss injury throughout this whole study was 9 days missed. And the researchers found overall that greater body mass was associated with greater injury risk. As we saw on the forwards, you can see there was, with almost every single injury type, they have a much higher chance of sustaining an injury as they have a greater body mass. So just a discussion on this experiment. High intensity running performance relationships to injury risk is that Stronger conditioning can allow a higher tolerance for workload on a body in a match. So the more conditioning someone does, the more prepared they are for that in-game scenario, and the less likely they are to have just a injury from running. And more running, not always, but generally implies better fitness. If a person runs more often, they're generally more fit, so that could lead to a decrease in injuries as well. And then efficient runs and training reduce the likelihood of experiencing some injury. So that's, as I said, as people as athletes condition themselves more and run in their training and participate more in high intensity running, their performance, will most likely be up to par when they're in an in-game setting or where they're actually in a match, and they will have a higher tolerance for that type of workload on their body, and that the demands that are being placed on their body in a match, leading to a less likely occurrence of injury. And then the relationship between impacts and head injuries. Increased collisions resulted in greater forces being transmitted to the head and the neck, which just leads to more impacts which leads to more head injuries overall due to more collisions and impacts happening and more forces being applied to the head and the neck. So some limitations of this article. All participants within the study were from a single club, all from university club teams. So it's difficult to generalize the data to pro players or to youth players or to any other levels of rugby players. This was only taken over one season. As I said, it was a 22-week competitive season. And, injuries, as we know, injuries differ every year. So the data maybe, have been very different from the previous year or the year to come. And so it would be in the researcher's best interest to maybe take data on more seasons and for a longer period of time to really determine the effects of all of these factors. And then with the global positioning system, it only measures external workload, as I said. So sometimes it does measure internal workload, such as heart rate, rate of perceived exertion, things of that sort. But in this specific experiment, it only measured distance, accelerations, collisions, things of that nature that are involved in external workload. So in the future, the researchers could connect to a heart rate monitor or other internal measuring device to measure internal workload as well. There's also no reported injury mechanisms. The researchers didn't specify how injuries occurred. They just kept track of the injuries. So, that could, it'd be a lot more helpful to have a specific data on how injuries occurred and whether that plays a role into the players. And then there's also no lifestyle factors included. So sleep, nutrition, and stress from jobs and academics were also not included in the study, and those could also be other factors. So just some key takeaways. Exercise demands vary greatly between backs and forwards in rugby. So position does have a great effect on exercise demands within rugby, at least within this study. Greater high intensity running is likely to decrease injury rates. So the more an athlete routinely is able to perform high intensity running, or just the better they're able to perform high intensity running within a game, that is likely to decrease their injury rates. Greater impacts and collisions obviously can increase the risk of head and neck injuries and just injuries overall. And the researchers also found that greater body mass is likely to increase injury risk as well. So just some clinical applications. It would be good for any healthcare professionals to individualize workload and training types to reduce the rugby player's injury risks based on position, anthropometrics, which is their body composition and their strength, and occurrences of impacts. So maybe their previous history or how much they experience impacts within game. And, based off that, clinicians and healthcare professionals can individualize the way they train and the workload that they experience, within training and within a game to collect more accurate data on injuries. So here's my reference, and thank you for listening.
Thank you, Jack, for that excellent presentation. Are there any questions? Or Dr. Lopez, do you have anything to add?
No, I think they always do a great job on their studies. They're using the GPS appropriately, capturing the data of the workload, and obviously for the youth, this kind of work needs to be done to evaluate what can be beneficial for them.
Any last questions? Okay, our second intern presenting is Elena from Long Island, New York. Elena will be presenting on the high prevalence of cannabidiol use within male professional rugby union and league players, centering on achieving pain relief and enhanced recovery. Elena, may you please share your screen?
Yes, thank you for the introduction. So today I'll be presenting on a review of the article High Prevalence of Cannabidiol Use Within a Male Professional Rugby Union and League Players, A Quest for Pain Relief and Enhanced Recovery. This was published by Casper, Sparks, and colleagues in the International Journal of Sport, Nutrition, and Exercise Metabolism in 2020. So as a background, CBD or cannabidiol is a non-intoxicating compound that is derived from the cannabis plant. It's believed to reduce exercise-induced inflammation, and some research suggests that this acts through CB2 receptors, which in turn reduces muscle soreness. Importantly, CBD was removed from the World Anti-Doping Agency's banned substance list in 2018. However, THC and other cannabinoids remain prohibited. So why would rugby players turn to CBD specifically? Rugby is a collision sport, and repeated collisions can cause chronic pain and muscle damage. Athletes commonly seek pain-relieving medication more than the general public, and they use painkillers 4 times as often. The aim of this study was to establish the current prevalence of CBD use in a large sample of professional rugby league and union players. The researchers hypothesized that CBD use is high in professional players, particularly among older players and those playing in the forward position. Their reasoning is that old players are more likely to carry chronic pain from a longer playing history, and forwards generally sustain more collisions and injuries than other positions. So this was an observational study using an anonymous online multiple choice survey with 15 questions regarding CBD product use. The participants were professional male players aged 18 and older who were competing in the English Premiership, the Rugby Union, and the Super League. This survey was designed to identify current CBD use in elite rugby and to assess players' understanding of anti-doping rules. Figure 1 in the paper, which is shown on the right, shows the recruitment breakdown by team and competition. In terms of the awareness and use of CBD, the awareness of CBD was very high. 91% of players said they were aware of it, and of those aware players, 26% said that they had either currently or previously used CBD. And 39% of the aware players that were aged 28 or older had used CBD as well. The use varied a lot by team, ranging from 5% to 70% across the 25 teams. Where did players learn about CBD? This came from mostly informal sources. The internet was 73%, other teammates was 61%, and other players or clubs was 41%. Far fewer players heard about this from nutritionists or other staff, which is a point that we'll come back to in the discussion. Of the 472 players aware of CBD, 339 had never used it. Their top reasons were a concern about an anti-doping rule violation at 64%, not being aware of any benefits at 37%, and not perceiving a need to use it at 29%. For the 133 players who reported that they had used or were currently using CBD, the top reasons were for improving recovery and pain, and sleep, followed by anxiety and other medical purposes. In terms of experience and efficacy of CBD use, among users, 67% reported perceiving some benefit, and the most commonly improved areas were sleep, recovery and pain, mood, and anxiety. No player reported any adverse effects, although the authors caution that this shouldn't be read as CBD is side effect free. On the doping side, 21% of users did not know if their product was batch tested for banned substances, and of those who assumed it was tested, 79% wrongly believed that theirs was. So CBD is currently being explored as a lower risk alternative to painkillers. However, it's important to note that it is not truly low risk. There is a significant information gap because most clubs advise against CBD use, yet players are turning to unqualified sources such as the internet or their teammates for information. The reported benefits are also not fully reliable. Although 67% of CBD users did report a benefit, there have been no randomized placebo-controlled trials, so a placebo effect cannot be ruled out. This is also an important area for future research. Additionally, the contamination risk is very significant. The CBD market is more regulated in the United Kingdom, where this study was conducted. However, it is still used in the US and it is not regulated in the US. Many users falsely believed that their product was batch tested, and there is a high risk of THC contamination. In terms of limitations, there were 13 different brands of CBD reported, with a lot of disparity in the reported doses. Some were reported as percentages, drops, milligrams, or physical quantities, such as a grain of rice sized. And there were different concentrations of CBD taken because of this. Also, the data collection occurred during COVID-19, so many teams declined to participate because they had previously advised their players against using CBD, but this may have caused a systemic bias because the players that participated might have already been interested or had used CBD. And again, because there was no randomized placebo-controlled trials of the effects of CBD on athletes, the self-reported benefits may not be fully accurate. So in conclusion, CBD use is prevalent and growing among elite rugby players. There is a 26% overall usage from this study, with 39% of the players 28 or older using CBD. So over a quarter of the aware players have used it despite hearing advice against it. Second, players need better resources. Right now, the internet and other teammates are the main sources of CBD guidance and education, and it's important for teams to be looking for qualified staff to fill this information gap. Lastly, there is a huge under-recognized doping risk. So many players wrongly assume that their CBD product is batch tested when it isn't, and there's a large risk of contamination. And this is my reference if anyone would like to further look into this topic. Thank you.
Thank you, Elena, for that very informative presentation. Are there any questions? Or Dr. Lopez, do you have anything to add?
I do have a question, Elena. I'm not sure if you'll be able to answer it, but if a player does get prescribed CBD because it is used in like the medical field or like that type of product, is that still against the regulations and rules?
So any CBD use is not against the regulations. It got removed from the banned list in 2018. So they can use it, but there are still risks that come with it.
Okay, thank you.
I also had a question just while you were looking at, the different literature and discourse with such a topic like this. Did you see or anything about, products that are being catered or marketed towards athletes specifically? I know if you are, a competitive athlete, especially very high level, maybe, we're not there quite yet as a society. But as far as athletes at other levels, I was curious if you saw anything regarding that, that could come out of a study like this one.
This study didn't reference anything specific, but I did look into it, and a lot of CBD products that were like for topical use were marketed towards athletes because that would they would be like formulated, I guess, to relieve muscle soreness, and that's a huge reason why athletes turn to CBD.
So,
Do you
Ilana, on
know
your
if a,
question, sorry, go ahead.
I was going to say, do you know if a lot of athletes will start with something like a topical version and then I'm not asking if that's a gateway, but basically is it a gateway? Do they start with topical and then move, progress from there? Do they seem to be uh really enjoying their experience with the topical product and, not need or feel the need to go further? Do you know at all? It's fine if you don't.
I don't, but I can I'm assuming that if they have a positive experience with the topical CBD, then they would probably be more willing to try other types of CBD.
So, thank you so much. That was a great talk. I think, just to clarify, even in the study, they said that the batches weren't tested, right? So, even though WADA took CBD off the ban list and it can be used in and out of competition, you're still at a high risk potentially of a violation. If any of the derivatives, the breakdown of the product gives any highlighting, you're still potential, you just don't want to be pulled, right? Think about it, right? You're at the World Cup. Take Tylenol, you know? You're that close, you know, and you're probably right, Danielle. You're probably saying that this may be the gateway to potentially using it in other capacities or even on a larger scale use across athletes. If that's what you're alluding to, I'm assuming it is problematic because the 4 or 5, what is it? THC, CBG, Delta 8, like the derivatives of cannabinoid, you know, cannabidiol, depends on how you want to say it. Those can be picked up if the batch isn't tested appropriately, and again, this is our biggest problem with vitamin supplementation. What is the problem? It is not anyone FDA regulated. So every supplement you take, from your children's vitamins all the way across to whatever it is, creatinine in weightlifting use, none of it is FDA really approved. They don't want to dabble in that due to the fact of so creatinine could be produced by maybe 20 or 30 producers. No one's going to attempt to try to regulate the byproducts or the production of that in mass quantity because there's no real purpose of that in healthcare. We all understand that, right? there's no grounds or evidence to use any supplementation in healthcare. So let's just to bring you that information, let's get back to CBD. Yes, they use it topically, and yes, they kind of use it for pain control. Even it's being really pushed across the older octogenarians, across the centenarian, 70 to 80-year-olds that, have arthritic pain, but they may not be candidates for a total knee or a total joint replacement. Maybe they got cardiac issues, or maybe they have other issues that they can't get a surgery because they'll die, maybe because of their comorbidity, potential for comorbidities. The issue is that of these derivatives, right, the synthetic versions, they're synthetically created, right? All supplements, and even this can be synthetically created. So we don't know what the processes are between companies in Asia versus companies in Australia versus companies in South America versus companies in Canada. And to attempt to try to regulate that is just really just vast, way beyond a government agency like the FDA to try to even regulate. So let's go to this. Natalia, you got your regatta coming up, right? Now that you have this information, would you take CBD?
Probably not, to be honest. When I was doing gymnastics, we actually did use a topical. Um, I personally didn't really see any like great improvements from using it, so I haven't used it since. So I personally would not try it again.
Okay, so I was just taking Natalia because she has a very big competition, a regatta coming up. So I'm just asking, if she was a competitive athlete right now in training, would she take, you know, uh, if that, how's this? I'm assuming you're in between, you're probably with a club regatta, and so it's not according to university regatta standards,
Yeah.
or right. So, but if you had evolved from your club and this regatta was maybe the national championships on the East Coast, right? They have them in Philadelphia, I believe, right? Don't they have
Yeah.
all the big
Uh-huh.
ones in
Yeah.
Philadelphia, right? So if they had that competition there and you were part of this with your club, would you take CBD if you had pain, or if everyone was taking it? Probably not, because you could get
Yeah.
pulled.
Yeah, I know for at least for the NCAA, we have drug testing, randomized drug testing that happens throughout the season. And
I
if
know.
something does come up positive, then you are pulled and
And
that
especially if you're a winning program.
yeah, so like I can speak for at least my program. We've been doing better over the past couple years. So we have had increased drug testing that's been happening. And it's obviously randomized, so you don't know who's gonna get it. It could be someone from your top boat, but it could also be someone from your middle boat or someone who's not competing, just it's randomized.
Yeah, I think it was quite surprising when they did the pinpricks at the East Coast Championships in DC at the Cherry Blossom tournament. And I thought that was, really surprising, let alone that it was a high school level. But
Yeah.
the variations of the size of the players.
hmm Yeah, I think just in general, with a lot of topical creams, it's become more normalized to use them. And I think that's why guidelines and just like testing has gotten stricter. I mean, for NCAA, like certain acne medications are seen as drug enhancing. So they've definitely become a lot more stricter on the guidelines.
What's interesting, I guess, and I'll say this, in high school, and this is why, rugby's looked at as under 19, under 16, under 14, under 12, right? Because of the vast changes in sizes and shapes or growth curves just at that kind of range between 14 and 18, 6, right? There's a very big difference, right? A football player in their junior year versus a football player maybe coming out of junior high school going into freshman year. There's a huge growth spurt at that juncture, but I was just quite surprised. But maybe, because it was such a high level to become like East Coast champs, it was a really, really kind of weird, competition. And let alone, I think there was because there was so much international representation there. I don't know if you guys know, but judo is ridiculously big in Brazil, right? Julia? Julia, we lost Julia. Anyway, so in Julia, in Brazil, overseas, Europe, Spain, really, really big in quite a few countries. So it was very, very diverse. There was a lot of languages spoken at the competition. That was probably the highest level competition I was at, like in my, aside from rugby, but I'm just saying at the within an institution. It was kind of surprising that they were doing finger pricks, blood testing. I guess that's where they did it. I don't know how much blood you need, but I'm assuming you need more than just a finger prick. But maybe then they probably were just, just testing overall. But obviously at the NCAA now it's really, really competitive because now you have the potential for nil. You have a lot more opportunities that weren't offered before. So I do think this will probably be very problematic. Now, obviously, it's off the ban list in WADA and USDA. All right, there's the U.S. Anti-Doping Association, but then there's the World Anti-Doping Association. But the U.S. Anti-Doping Association also is concerned about its application, if that's the best way. And I don't know if you use it topically, how much can penetrate to a point where it's blood systemic, I think all that is out still. I don't even think, any of that's in. It's very complicated. I just can't tell you. It's very challenging right now, probably the direction of this. Elena, did you find any other literature? Did you do a little search on anything of this?
I don't have any written down, but I like searched a bit. Yeah.
All right. So and like I said, they're trying to certify them, but I don't know, if those certifications work. So now we're talking about they're not FDA approved, yeah, but they're trying to do certifications for them, and they're trying to get like the National Science Foundation or the BSCG, like to kind of certify these products with third parties. But they've been trying to do that with some of the supplementations for years, right? The B complex, they think there's a famous one that, everyone uses. The B complexes, right? B6, B12, I'm just saying you can't really, even though you get a certification, doesn't mean it's, the company may get the product from maybe 3 to 4 different producers, but they fill it up their jar with those tablets. So they may get the tablets from Australia or Canada or South America, but they're all under, one company. I don't want to, I'm trying to avoid saying names of companies. So bear with me if I stutter. It's because I'm trying not to say the company's name. So when you know what I'm talking about, there's different companies and they produce these vitamins, they produce these supplements, and they get their batches. And this is why I think one of the big points you pointed out, Elena, in the study is that they're avoiding, batch testing, or they don't know where the batches are tested. And let alone, I'm assuming they're getting them from more, Northern African countries, maybe, or maybe, Eastern Bloc countries. They're getting a lot of that, produced at a cheaper rate, just business wise, right? And then imported and then packaged. So, like I said, there's a lot of loose, and that's why, they've always refrained from doing this or allowing this to be used. And I think what happens is that, listen, you're going to come up, you're going to, if it's in your, if you're using it that often, it's going to get systemic. I think that's the one thing that athletes need to understand. If you're using it with frequency, it will become systemic. And then when they draw your blood, you'll most likely be positive. And it'll most likely become a violation. Or minimally, you're going to be tested, and that may delay you from competition. They're not going to soil, the competition will not soil its tarnish their name for one athlete. They will sacrifice that athlete. So it's a challenge. I try to tell this to the athletes, be very careful with that stuff. But if, again, I think, Elon, you alluded, if you get a script to do it, or, if it doesn't matter. Even if you get a script, say for Tylenol 3, right? That's Tylenol with a little codeine, Yes, you have a physician's prescription for you to utilize that for your well-being, but doesn't necessarily mean that it's for the well-being of the competition or the tournament or the governing body's purposes of avoiding sport enhancement. So it's a challenge. It really is. Sorry, I didn't mean to digress so much on that one, but I wanted to make sure you understood that it is quite challenging, and again, there's so many variations, Delta 8, Delta 9, Delta 9 is allowable through the urine. Like I said, I would probably say that you got to be very careful, as long as whatever team you're with, the physician knows. They got to be well aware. They've got to pass, some modules to like test themselves to understand what's, usable, what's capable, and the windows of which these, drugs are metabolized. Can't trust everyone. You got to trust yourself, particularly in competitive sport. All right. Sorry. What's next?
Well, that will conclude week 8 of the RRIPG Institute and Rugby Research and Injury Prevention Group Journal Club. Thank you all for attending.